I am a graduate of the Medical College of Wisconsin, graduated in 1990, did a 5-year residency in anatomic and surgical pathology. That's about as loud as I can go.
Sorry,
Why don't you come up here? Finished that in 1995 and started working in pathology labs, mainly at Columbia St. Mary's here in Milwaukee. My main area of interest was diagnosis of breast cancer. Throughout that time, I read every book I could on breast cancer. Towards 2007, 2008, I read a book that really kind of inspired me, and it was, I don't know if we have it here. It was, it doesn't look like we have it here. It's called What Your Doctor May Not Tell You About Breast Cancer, written by Dr. John Lee, and he describes hormone imbalances that contribute significantly to induction of breast cancer. I found that whole concept to be absolutely fascinating. I went, obviously studied up on it, went to Atlanta and trained with Dr. Gregory Zengo, who is a professor at Emory, and learned how to do bioidentical hormone balancing, and I do medically managed weight loss with a focus on HCG diet because it's the best diet out there. And the main reason I'm interested in this is because the weight loss reduces risk for breast cancer as well as other cancers and other chronic diseases. So that's a little bit about my background. I'm just going to give you a kind of a whirlwind tour of diet and HCG in particular and the obesity epidemic. I'm going to try and keep it short and sweet. If anybody has any questions while I'm showing you the slides, just raise your hand and I'd be happy to answer them. So I'll touch a little bit, very little, on kind of the background of the obesity epidemic in this country, the role of food addictions. Anybody in the room feel they have a food addiction? Yeah, carbs, sugar, that kind of stuff. Yeah, anybody addicted to broccoli? Raise your hand. Why do I never get anybody addicted to broccoli? There's a reason for that. How proteins, fats, and carbs are handled by the body and why HCG works so well, not only for weight loss, but for maintenance of the weight loss. So a little bit about the obesity epidemic. Globally, it's not just a problem in this country. Globally, it's kind of reached pandemic proportions. There's actually much more obesity in the world than there is famine and starvation. 1.5 billion adults were overweight in 2009. And 65% of the world's population live in countries where the number of obese individuals outnumbers the number of underfed. And from a medical perspective, we're very concerned about how this is leading to type 2 diabetes. As a matter of fact, Dr. Mark Hyman, everybody know who Dr. Hyman is. He has kind of coined the term diabesity, which is the combination of diabetes and obesity. They really go hand in hand because as your weight goes up and up, you lose your sensitivity, your insulin sensitivity, and eventually develop type 2 diabetes. Heart disease, stroke, hypertension, certain cancers, and premature death. The cost to this country in dollars, in billions of dollars, is shown here. So we're starting out 1993. I only have the data up to 2009, so we're looking at $150 billion in obesity-related chronic disease and medical costs. I'm going to show you some data from the CDC, which I find really interesting. The CDC has actually been tracking the percentage of the population that's overweight and obese since 1986. And they have this on the website. Anybody can look at it. But what they've done is track the percentage of the population of each state that has a BMI of 30 or higher. So just to refresh your memory, the BMI is only based on height and weight. It's not the greatest measure of health and wellness, but it's very simplistic. So this chart shows BMI, and you see the y-axis here is the pounds, and then the x-axis shows the height. So it's just height and weight. a BMI up to 25 is considered normal. 25 to 29.9 is considered overweight, and anything 30 or above is obese. And so the data I'm going to show you from the CDC measured everybody who was a BMI of 30 or higher, so truly obese. This picture, I just want to illustrate why the BMI is not the greatest measure of health, because you see, and we see this most commonly in men, where you can have two individuals, both the exact same height and the exact same weight and the exact same BMI. Why are they so vastly different? And that has to do with percentages of lean body mass and percentage of fat. So this individual probably is 55% fat, 45% lean, and this individual is probably 25% fat and 75% lean. That has a lot of significance as far as your metabolic rate and how many calories you burn even when you're sleeping, and your ability to maintain your weight. So I'm going to just run through the data. First of all, what they did was create maps that show the percentages of the population that are overweight or obese. So the grayish blue is showing states where we had no data. This is for 1985. The light blue had less than 10% of the population were obese or had a BMI of 30 or higher. And the dark blue had 10 to 14% of the population was obese, and notably Wisconsin is in that. So that was 1985. I'm going to scroll through each year. Now I'm up to 1987. Here's 1988, 89, 90. 91, so it's pretty obvious that this is becoming a very significant problem in a very short period of time. In 1991, they actually had to add another color because all of a sudden we have, in many states, more than 15% of the population has a BMI of 30 or higher. There's 1992, 93, 94, 95, 96. 1997, the same thing. They had to add on another color because all of a sudden we have states that have over 20% of the population in the obese category. 1998, 99, 2000,
all right.
2001.
I made it.
Yep. 2002, 03, 04, 05, 06, 07, 08, 09. Here's a comparison. So in one decade, from 1990 to 1999, the percentage of people who were obese doubled, and then it doubled again. And in my opinion, this is the most significant health problem that we face in this country, and it's going to absolutely bankrupt our healthcare system. So why is this happening? That would be a whole hour talk in itself. And my goal tonight is just to give you an overview and not get into too much detail about what the theory is behind what's going on with the obesity epidemic. There's so many factors. The top factors are stressors, both psychological and physiological. When I say physiologic stressors, I mean horrible food that we're eating, a lot of processed food, a lot of preservatives, artificial flavors, artificial colors, genetically modified foods, the lack of exercise, just the general stress level. The thing I really like to look at very carefully are hormone imbalances, because it's pretty clear that there are more and more patients with disrupted hormones because of all the chemicals and toxins and pollutants and things in the food. So the hormone imbalances are contributing to weight gain significantly, and this is something I talk about with every single patient, because I don't think you can really separate hormone imbalances and weight gain. They really go hand in hand. So almost all of our patients who are overweight and need weight loss services have some sort of thyroid problem, either overt, Hashimoto's thyroiditis, or they've been on thyroid hormone for years, or they might have a functional hypothyroid state where they're not producing enough T3, or they have autoimmune disease. sex hormone imbalances, estrogen dominance, and progesterone deficiency. In men, we're seeing a lot of androgen deficiency. Men go through the exact same decline in hormones that women do. They have andropause. So about 10% of my practice is male, and they have very low androgens and adrenal fatigue and very often impaired thyroid function. So I look at this very carefully. I had asked before about the food addictions, and the reason I bring this up is that the HCG is absolutely perfect for helping to break food addictions, because it's working on the same part of the brain that controls the food addictions in the first place, which is the hypothalamus. Anybody who's interested in reading more about food addictions and the role that that plays in the obesity epidemic, this is the book to read. It's called The End of Overeating, written by Dr. David Kessler. And Dr. Kessler was actually the head of the FDA under President Bill Clinton. And when he left the FDA, he wrote this book, and it is absolutely fascinating. The subtitle is Taking Control of the Insatiable American Appetite. But he really lays out beautifully how the food companies and the restaurants and food manufacturers have known for decades about the addictive qualities of certain foods, and they deliberately infiltrate our entire food supply with wheat and things that have the addictive property, because the food companies want us to eat more and more. That's how they make more profit. So this, I highly recommend this book. So talking about food addictions, the addiction center is the hypothalamus. It's the exact same part of the brain that is causing problems in patients who are addicted to drugs or gambling or smoking or alcohol. It is all the same part of the brain. It's the hypothalamus. Diet pills I will not talk about too much. People spend a lot of money on diet pills. They work for the short term, but once you go off the diet pill, you gain the weight back. And that's where HCG, I think, is just superior to diet pills, because we have a strategy and a protocol for when you come off the HCG and go into maintenance. I'll touch on that a little bit. That enables you to stabilize at the lower weight and not gain the weight back. So what is HCG Diet? Well, what we're doing is following a protocol written by a physician back in he wrote the protocol in the 1960s, but he did his research in the 30s, 40s, and 50s. His name was Dr. Simeons, and he wrote a manuscript called Pounds and Inches. So he was the first one to experiment with the use of HCG injections combined with a very low-calorie diet, which enabled very significant, rapid, sustainable weight loss, and specifically weight loss of the fat component and preservation of muscle. So I won't go into a lot of detail about how he figured this out, but he, suffice it to say, very long story short, is that he made some observations when he was in India regarding women who were on very low-calorie diets involuntarily because of famine and lack of resources and starvation. And he noticed that, first of all, that when they lost weight, because they weren't eating much, they weren't hungry, they were only burning fat, they were preserving their lean body mass, and the babies were just fine. The babies would be born normal size, and they weren't premature, and they weren't emaciated, and there was no increased risk of miscarriage. So he came up with the hypothesis that something about pregnancy enables the pregnant mom to burn the fat for the benefit of the unborn baby or embryo. And he took that hypothesis and he tested it, just like a true scientist. He experimented with different dosages of HCG, different food combinations, and he actually then went back to Italy and opened up an obesity clinic and kind of experimented on patients for 30 years, but was very, very successful, treated 10,000 patients. His manuscript is mandatory reading, and I do have this on my website. You can download it. It's a PDF if anybody's interested in reading it. I give a copy of that to all of my HCG patients and ask them to read it.
Are you going to give us a handout with your email on it?
Yeah, I can. I actually, there were so many slides I couldn't print them up.
No, just so that we
yeah,
have like that.
yep, absolutely. I'll get that for you. There's another book about HCG out there, Kevin Trudeau's book. I do not recommend this book, but I just want people to be aware of it. Unfortunately, Kevin Trudeau's a bit of a shady character and doesn't even live in this country. He has fled to, I think, Sweden to escape fraud and tax evasion charges by the federal government. But a lot of people who are talking about HCG will say, oh, I read Kevin Trudeau's book and I'm following Kevin Trudeau's protocol. For my patients, I just want them to know that that's out there. And a lot of people equate HCG with snake oil because of Kevin Trudeau's contribution to HCG Diet. So for my patients, I tell them, if anybody asks you if you're following Kevin Trudeau's protocol, the answer is absolutely not. We're following Dr. Simeon's protocol. In this country, you can only get real HCG with a prescription. So there's quite a bit of homeopathic HCG out there. It does not have HCG in it. If you took it and put it on a pregnancy test, it would not turn it positive. The FDA came down hard against homeopathic HCG in December of 2011 and has taken the stand that the manufacturers of homeopathic HCG are being deceptive and not truthful, and that they need to stop claiming there's HCG in the homeopathic HCG. So.
And when you say homeopathic, is that the same? I see GNC is selling it also. So
Yep.
would that mean homeopathic?
Yeah,
Okay.
yeah. So the stuff at GNC and Walmart or things you order on the internet, they're usually in dropper bottles like
Yes.
that. There's no way, first of all, homeopathic means it's been diluted out so much that there's no true molecule there. You have the essence or the vibration of the HCG, which doesn't really make any sense when it comes to HCG. But the other important point is that HCG is very fragile. It has to be kept refrigerated once it's reconstituted. So the pharmacists get USP grade HCG from a US lab, but it's in a powdered form, and it's stable in powdered form, but once it's reconstituted, it's going to lose potency in 4 to 5 weeks in a refrigerator, and if you left it out on a counter, it would degrade within days. So anything that you're seeing on the even if it ever did have HCG on it, it's been completely degraded. It's just the nature of HCG. So obviously we get our HCG from PCAB accredited compounding pharmacy right here. The pharmacists do an amazing job. We have the only sterile lab in the state of Wisconsin for production of HCG. There are other compounding pharmacies in the state, but none of them have sterile capabilities. It's not so much an issue if we're doing the sublingual. I really encourage patients to do the injectable because it's just more efficient and it works better. But once in a while we'll have a patient that just does not want to inject themselves. So then we will do the sublingual. It's a little bit more expensive because we have to dose it twice a day instead of once a day, but then we don't have to worry about sterility too. So I strongly recommend the injectable HCG, and it is a tiny itty bitty needle. It's an insulin needle basically. It's a 31 gauge insulin needle. It is not like a flu shot that goes into your muscle. You're basically pinching a roll of fat, cleaning off with alcohol, and it goes in like butter. It's nothing. I've done it myself, and it's painless. It doesn't hit the muscle. And we do that once a day for 50 days. As I mentioned before, the true test of potency of the HCG is whether it would turn a pregnancy test positive. So I do recommend that patients follow Simeon's protocol exactly as described. We provide 50-day supply of HCG, and then after the HCG, we take patients through the maintenance process. So maintenance is phase 3 and phase 4. Phase 3, I'll go into in a little bit more detail, but that's basically reintroduction of foods except for sugar or grain. And then phase 4 is just very cautiously, having carbs or grain or sugar once in a while. So as some of you know who've done the protocol, while you're on the HCG, the first 2 days are loading days. And that means you eat as much high-fat food as possible. After you've done that for 2 days, on the 3rd day, you're going to go on a very low-calorie diet. So it is 500 calories per day. And this is probably the biggest criticism of the diet. Seen dietitians on Dr. Oz saying, there's no way you can survive on a 500-calorie diet. Well, 2 things. First of all, the HCG is preferentially helping you release the fat stores. And those fat stores are circulating and providing you all the calories and nutrients that you need. That's why we store the fat in the first place. So the HCG is playing a little trick on the body to get fat cells to release the stored triglycerides. So that alone is suppressing hunger. Secondly, when you think of 500 calories, it does sound like a very small amount of food. Volume-wise, you're going to get a very, very large amount of vegetable. So the protocol is 2 servings of protein. That's restricted 3.5 ounces twice a day. 2 fruit servings, 3.5 ounces. Dr. Simeon's had included 2 servings of grissini breadstick or Melba toast. And then after that, all of the rest of the calories are filled with vegetables. And I'm going to go over what the vegetables are. Dr. Simeon's only recommended 13 vegetables, and if you pick from those 13, you can have as many as you want. I mean, if you want to eat 4 pounds of cucumber, you can. So that's another reason why patients really shouldn't be too hungry. So I've mentioned a couple of times that we have, when our patients are on HCG, they're preferentially burning fat and preserving lean body mass. And I don't expect anybody to take my word for that. So what I do is a body composition analysis before the patients start. And this is a body composition analyzer. This is not mine. This is just a picture I got on Google Images. But we just attach 2 electrodes to the hand, 2 electrodes to the feet. We have a current run through the body, and then the computer will measure reactance, resistance, impedance, and phase angle. The basic principle is that the current runs faster through water. So fat contains virtually no water. It's only 4% water, and then muscle contains like 40% water. So the current's going to go faster through muscle, slower through fat, and then we can figure out what the percentage of fat and percentage of lean is before you start the diet. And obviously we can make the calculations and figure out not just what the percentages are, but what, like if someone weighs 200 pounds, we'd be able to figure out that they're 100 pounds fat, 100 pounds lean. After the diet is over, we repeat this process, and if, say, our female patients lose 25 pounds in a 50-day period, if we have a patient lose 25 pounds and we repeat this, we're going to be able to see that probably 23 pounds is lost out of the fat component and only 2 pounds out of the lean. And that's what sets HCG apart. And the homeopathic HCG, a lot of people out there saying they lost weight and they did great on homeopathic HCG. They lose weight because they're on the very low calorie diet, but they're much more hungry and they lose weight in a very different way. They lose approximately equal portions of muscle and fat. Are there any questions about that? And I actually, if anybody's interested in getting a body composition analysis, I have, you can get one for free. It's not with me, but it's with my staff in my office. So these are coupons if you want to, if you don't mind just passing those around. That if you're interested in just seeing what your percentage of fat, percentage of lean is, you can come on in and have an appointment with one of my staff members, and they'll do this on you and give you a little computer printout, and it'll scare you a little bit.
Do you do consultations before you recommend people take the HCG?
Yeah. So typically what I do is go over the health history, and I don't just prescribe HCG, I require a little bit of medical workup. So I need a copy of a physical exam done within the last 12 months, and then there's a couple of labs that I want that have been done in the last 3 months, or else we'll do them on you. And that's a CBC, which is a complete blood count, and a CMP, which is a metabolic panel. And the reason for that is we obviously just want to make sure that everybody is perfectly fine and able to do this without any problems. I want to make sure there's no liver problem, kidney problem, anemia. I have 2 experiences with having to exclude patients from HCG. One was a male patient who had a very abnormal CBC, and he was about to go on HCG. Long story short, he ended up getting diagnosed with leukemia. And then actually he had 3 malignancies. He had a CLL, he had a monoclonal gammopathy of uncertain significance, and he had a hairy cell leukemia. It was unbelievable. And then about 6 months ago, I had a female patient getting ready to go on HCG, and she had an abnormal CBC, and she got diagnosed with chronic eosinophilic leukemia. So it's very rare, but needless to say, if that's going on, weight loss is the least of your problems. We want to kind of focus on,
What about medications? Are there medications
Yeah.
that are a problem with this?
No, as far as other types of patients that are excluded, there's no real medication. Type 1 diabetics are excluded. We can't manage, type 1 diabetics. Type 2 diabetics are fine, and we have a lot of type 2 diabetics, and we've gotten them off of their metformin, and I've had type 2 diabetics who are not only on the oral hypoglycemics but on injectable insulin, and they're able to get down the dose. I've had a lot of hypertensive patients.
What about people on warfarin?
Pardon?
People who take Coumadin?
Coumadin?
Mm-hmm. Does that affect the Coumadin at all?
No,
The proteins?
no,
No.
no, not at all. Might have a little bit more bruising, but no, not a problem at all. Mm-mm. Any questions about the body composition? So there's only 4 allowed fruits, and it's grapefruit, apples, oranges, and strawberries. The veggies, there's 13 allowed veggies, but this just shows all the green leafy veggies and the cabbage. I think Swiss chard, and I don't even remember the names of all these. Obviously spinach. And then the really good ones are the cucumber, tomato, onions, and radishes. You can make a huge salad. And I teach my patients, pardon me?
Can we juice it? Take it in juice form?
No, I wouldn't recommend that. Because when you juice anything, whether it's veggies or fruit, you're removing the fiber and you're drinking just the liquid carbohydrate, which is sugar, and it's going to spike your blood sugar. You can blend it, but you shouldn't juice it.
Oh.
Blending is the way to go, because then you still have the fiber, and the fiber is what slows down the absorption, so you don't have a very rapid spike in your blood sugar. Celery, asparagus, and fennel. The meats, there's quite a few meats. A lot of seafood, scallops, shrimp, crab meat, steaks, chicken breasts. For vegetarians, or as Dr. Simeon said, for patients who grow weary of the meat, he allowed eggs. He allowed eggs, to be specific, 1 egg and 3 egg whites per day, and that would be a protein serving, or fat-free cottage cheese. And the other thing we've done, I have some vegan patients who have been very, very challenging. But so in that case, we're having to use not the egg white, but a different protein powder for them. As far as sweeteners, all of these are bad, except for the sweet leaf stevia. I'm really trying to teach patients about, and I have handouts on all this, about the endocrine disrupting qualities of aspartame. Truvia is actually a mixture of stevia and erythritol, so this one's okay, but the stevia is the best, and obviously the sugar and the rest of these should, whether you're on HCG or not, they're poison. We encourage patients to drink quite a bit of water. whatever your body weight is, you divide it in half, and that's how many ounces of water you should be drinking per day. We like to help patients with making their food, getting creative with their food. The food can get pretty boring. Patients are typically not hungry, but they're pretty bored. But the best HCG cookbooks are Tammy Skye's, and she has actually 2 of them. This is the first edition, but the recipes in there are absolutely fantastic and really help patients get through the diet with some creative choices.
You said that was Tammy Skye?
Tammy Skye, yeah, it's spelled S-K-Y-E, and her first name is Tammy. Exactly as described by Dr. Simeons, you can continue your current level of physical activity, but we don't want you ramping up physical activity when you're on HCG because you're going to burn through your calories too fast and get fatigued and get hungry. So whatever you're currently doing, you should do. Once you're off the HCG and going on to maintenance, we're really encouraging patients to ramp up exercise. First, 3 weeks of aerobic, cardiovascular, and then after that, some resistance training and strength training so that we can always be working on improving that percentage of muscle and decreasing the percentage of fat. Our typical results for female patients in a 50-day period, we're seeing usually a minimum of 23 to 24 pounds. I will never say what the maximum is because it creates unrealistic expectations, but it's much more than 24 pounds in 50 days for females. Males always do better. They're hitting it a pound a day. I can't explain why that is, but that's just the way it is. Male patients will lose 50 pounds in 50 days. I have one male patient who lost 50 pounds in 50 days. He was doing so well, he wanted to keep going, so we got him another vial of HCG. He kept going. By the end of 75 days, he had lost 80 pounds. And it was really good. This is somebody who was a type 2 diabetic and high blood pressure. And so maintenance, this is the most important part so that you can maintain your weight loss. So the first 3 weeks after maintenance, you can eat any food that you wish with the exception of sugar and grain. And the only rule is you weigh yourself every single day. And if you ever gain more than 2 pounds over whatever weight you were on your last injection day, then you have to do a correction day. And you do that for 3 weeks. A correction day is a steak day as described by Dr. Simeons. So that means no breakfast, no lunch. And at 4 p.m. or later, you can have a huge steak plus either an apple or a tomato and drink a ton of water. That's a correction day. 100% of the time, that will result in the 2 pounds coming off, and then you're back to where you were. So long as you keep that weight stable within 2 pounds of your last injection weight for 3 weeks, that'll be your new normal, your new kind of set point for your hypothalamus, and then you can go on to the rest of your life without worrying about it too much. When we have patients reintroduce food, we're kind of looking at a golden opportunity to weed out food sensitivities and food intolerances because you've been off of the nasty stuff for 6, 7, 8 weeks. So I encourage patients to keep a diary. I provide the diary, and you reintroduce one new food at a time. If you reintroduce too much stuff too fast and you get some gas, some bloating, some weight gain, you're not going to know which food is the culprit. So I really like to have patients just reintroduce one new food per day. And if there's any symptoms, like GI symptoms, I want you to remove the food and wait 3 or 4 more weeks before you try it again. A little bit more detail about the reintroduction of foods. The first week, we have patients eat all the same foods, unlimited quantities. You don't have to weigh foods anymore. You don't have to count calories. You can eat the same foods you were on HCG, but as much as you want. And you eat till you're satisfied, and then you stop eating. In that first week, you're also reintroducing all the fats. So the real butter, the coconut oil, extra virgin olive oil, the eggs, the fattier meats. Should never be using things like Smart Balance or I can't believe it's not butter. That stuff is a disaster. Needs to be thrown in the garbage. In the second week, we're bringing in higher glycemic fruits and vegetables. And then in the third week, the dairy, nuts, and beans And then that's it for phase 3. And then phase 4, we're very cautiously reintroducing carbs. So I actually have tons of before and after photos. I just never have time to put them on my website. It's crazy. But this is one of my very first patients, and I met her here. And actually, this is that office right there. But she went through the process and just did absolutely fantastic. So that was kind of a whirlwind tour of HCG Diet. I didn't get into a lot of detail about anything specific, but I thought I really wanted to make time for question and answers if anybody had any questions or comments or anything.
Well, I'm just kind of curious about, this hormone that you create when you're pregnant, okay, and then introducing it into a male body
Yep,
even.
yeah, it works exactly the same way. Yep, yep. Isn't that interesting? Dr. Simeons describes that in his manuscript, that it works exactly the same on males as females as far as the fat burning. We use the exact same dose, whether it be male or female, whether the patient has 10 pounds to lose or 200 pounds to lose, whether the patient is very old or very young. My youngest patient was 10 years old, and she turned 11 when she was on the diet. And her mom brought her in, and at first, my first reaction was no way, but this was a very articulate, it was a 10-year-old going on 30 type, and she was very articulate about how the obesity was kind of ruining her life, and she's getting teased, and she was being excluded from sports and other things, and it was just so devastating to her. So we decided to give it a try, and it worked great. That little girl lost 20 pounds and maintained it. My oldest patient was 84. Exact same dose, whether you're young, old, male, female. Any other questions? Yes?
What is the cost of this? Is it covered by insurance at all?
Great question. So I provide this service at 2 different locations. One is at Dr. Corcus's office. Does anybody know who Dr. George Corcus is in Waukesha? So I'm at Dr. George Corcus's office on Thursdays. My primary office is in Glendale, and I'm there Monday, Wednesday, and Friday, and also Saturday. As far as the cost, there's sort of 2 levels. I provide this service in groups at a discount from the one-on-one. So the one-on-one services with me, it's a series of 5 appointments over 3.5 months. And if somebody wants private appointments, it's $1,500. If somebody wants a discount, they can have it for $900, but it's not one-on-one with me. It's in a group that I manage. The groups are up to 12 people. We never have more than 12. Usually it's about 8 to 10. And we'll take a group of people through the process, the same exact process. It's a series of 5 appointments, approximately every 3 weeks. And my staff provides all of the additional support anytime through the process. If patients are having questions or problems, they call the office, and the staff has all done HCG, so they know exactly how to answer all the questions. So to answer your question, the group price is $900, and the private appointments with me are $1,500.
But does insurance cover any?
Well, we're not contracted with insurance companies. We do provide the paperwork for patients, whether it be the hormone or the weight loss. We provide the paperwork that has the itemization of, now in the case of hormones, the insurance will pay it, but they pay out of network, rates, which is 70% or whatever. For the weight loss, insurance companies typically won't pay for that. However, we have it broken down so that there's 5 physician office visits, and we have the CPT codes and the dollar amounts. Sometimes insurance companies will pay that, and they'll pay out-of-network rates. But then the supplies, like the HCG, the needles, that's all included in that $900 price. The HCG, the needles, the Sharps box, the alcohol wipes, the diary, insurance, I've never seen an insurance pay for that, which is really unfortunate. They should, because they'll pay everything for your triple bypass and your mastectomy and your colon cancer, no questions asked. They'll pay for the reconstructive surgery of your breast and the lymph node dissection but will they pay to prevent those diseases from happening in the first place? Not at this time. It's very sad. Very good. I just have one last thing. I wanted to give you a postcard. I am a member of the Wisconsin Integrative Medicine Society, which is abbreviated WIMS. And our mission is food is medicine. And we formed last year basically to educate the public about the importance of kind of going back to basics and getting back to eating healthy food, preferably locally grown, organic, fresh food, and getting away from the heavily processed foods and what an impact that has on patients' health. We had our first event last year on December 1st at the Country Springs Hotel, and it sold out. 400 people, it sold out. So we're getting ready for this year's event, which is going to be on November 23rd. So if anybody in the room is interested in food as medicine, I encourage you, I'm going to give everybody a card. To get on our mailing list, to get our newsletters, you can go to our website and all the information is here, and then opt in for our newsletter. You enter your name and your email address, and then you'll be getting our weekly newsletters, and it'll inform you when the tickets are available, all the details of the event, and it's going to be a lot of fun. This year we have 12 speakers, so it's really going to be an amazing event. So if you don't mind, just pass these around for me. So thank you everybody for coming. I appreciate everybody coming tonight, and I'm available to answer any questions. I look forward to hearing from you.